CJ is a 19-year-old pleasant African-American female who comes to the office with complaints of urinary frequency and lower abdominal pain that started 3 days ago. HPI, patient reports having moderate lower abdominal pain that started 3 days ago. Pain is constant and described as spread pressure in lower abdomen and worsens during urination, intercourse, or bowel movement. The patient has over-the-counter ibuprofen with some relief when she takes it. Symptoms are not going away. It really interferes with her activity of daily living and sleep. The patient thinks that's UTI since she started a new relationship with a new partner last week or week ago. Past medical history is not significant to the current encounter, but includes pharyngitis that completely resolved with an ambulatory antibiotic treatment in December 2019, and she had appendicitis when she was 9 years old. Patient was hospitalized, surgical treatment, antibiotics successfully resolved. Medication and allergies. So patient currently takes only 400 milligrams of ibuprofen as needed every 8 hours for pain. Patient doesn't have any environmental or medication allergies. Social history. Patient has a high school diploma, works as a cashier in one of the local supermarkets. She lives with a roommate in a rental property, denies alcohol use, smoking, vaping, or drug use. Report that her interpersonal status is single with a new relationship that she started a week ago. Family history. So both patient parents are alive. The patient has no living siblings. Past medical history not really relative to current condition, since father had diabetes and mother had hypertension. Gynecological and sexual history. So menstrual history, age in menarche 13 years old, last normal menstrual period 10 days ago, cycle length 28 days, the irregular duration 4 days, flow normal, consistency and color, no clotting. Also menstrual irregulation not reported. Patient identifies herself as a heterosexual female with a current one partner in relationship, type of sex, vaginal or only. She denies oral or rectal, reports satisfaction in her orgasm. Some pain with sex started 3 days ago, and she doesn't have any other sexual concerns. Patient denies use of contraceptions or barrier methods. She never had been pregnant, never had abortion, never conceived, and never had a baby delivered. Patient denies previous vaginal infection, and she have never had a cervical cancer screening since she's 19. So review system, grossly within normal limits. Skin doesn't report any bruising, discoloration, good turgor. Head and face, no pain, no recent traumatic injury or ptosis. Ears, no bilateral hearing loss. Eyes, no changing vision. She doesn't wear glasses. Mouth and throat, no dental problems. Nose and sinus, and no discharges, epistaxis, sinus pain or obstruction, no loss of smell. Respiratory tract, no mentioned coughs, sputum, night sweats, no or wheezing. Cardiological system, no chest pain, dyspnea, palpitation. GI, so no nausea, vomiting, diarrhea, constipation, dysphagia or heartburn. She has a good appetite, newly started pain in lower abdominal 3 days ago. Urinary tract, no dysuria, newly reported frequency, but no urgency, no incontinence. Genital tract, no discharges, no pruritus, pain or discomfort as mentioned in HPI during sexual intercourse. Skeletal system, no swelling, no deformity, crepitation, pain, joint in extremities, patient able to perform full range of motion. Nervous system, so no dizziness, tremor, ataxia, syncope, seizure, no significant changes in memory. Endocrine system, no polydipsia, polyphagia, diaphoresis. Psychological status, patient denies any nervousness, instability, depression, dementia within, no memory losses, no disorientation. Okay, next one, physical examination. So vital signs. Vital signs we have is that her weight 61.9 kilos, height 5'7", temperature 98.5, respirations 18, pulse 76, blood pressure 116/62, and saturation 99 in room air. So generally, CJ is a well-developed, well-nourished female in mid-distress. HENT, pearl, sclera clear, conjunctiva pink, face symmetrical, good dentition, nearest pattern, grossly hearing intact. Neck supple, no lymphadenopathy, no tenderness, respiratory respiration even, unlabored, clitoral scatation bilaterally, no wheezes or other adventition sounds noted. Cardiovascular system, so PMI not standard normal size, thrill or hives, S1, S2, no murmurs, raps or gallops, pulses are palpable in all extremity and plus 2. Neurologically, all cranial nerves grossly intact, all auditory and times 4, deep tender reflexes intact throughout without clonus or hyperreflexia. Musculoskeletal, so gait within normal limits, ambulates without any assistive devices. Abdomen, no distended, no scar, hyperactive bowel sounds, no bird, tendon tender to palpitation, no hepatosplenomegaly, no masses. Reproductive, so this is for female, it will be extended. So breast exam, medium size, symmetrical, 1 nipple per breast, central placement, no inversion discharges, no skin changes, rashes, lesions, dimpling or retractions, no masses, palpated or lymphadenopathy, no tenderness noted. Pelvic exam, so external genitalia, feminine type of hair distribution, labia major minor within normal limits, Bartholin and Scans glands are not palpable, hymen not visible, perineum within normal limits, no masses, lesions, scoriation, erythema, tenderness or discharges detected. Pelvic exam, internal genitalia, vagina pink color, irrigation within normal limits, normal muscle tone, no cystocellular rectocellular discharges, cervix pink in color, mid-os, central position, smooth texture, mobile, no lesion or discharges. During manual pelvic examination, uterus smooth and palpable, anterior placement, midline, normal position, size about 5 by 5 centimeters, mobile, no masses, but patient reports some tenderness during bimanual examination. Laboratory values. So they showed negative pregnancy test. Urine dipstick results were significant to increased specific gravity, moderate leukocytosis, and some nitrates. So gonorrhea, chlamydia testing were negative, but when we sent a urine to the for evaluation for chlamydia, results came back positive. So assessment and plan based on assessment, physical examination, HPI, and lab values can be concluded that the diagnosis for this encounter is chlamydia. The disease often is represented like urinary tract infection, but take into account newly started relationship, unprotected sex, clinical presentation, and supportive lab values that we received. It can be stated that chlamydia will be the primary diagnosis. During the pelvic examination, patient have not developed higher severity to represent more disease progression. Looks like that just at early stage. It is important to determine that chlamydia, differentiate chlamydia from gonorrhea and trichomonas, and for encounter we have negative lab values. Appendicitis also can be excluded since patient doesn't have fever, rebound, abdominal tenderness. Cystitis also can be excluded. The patient doesn't have a symptoms of sharp pain, burning during urination, or general infection present. Patient will be discharged home and treated with azithromycin 1 gram orally as a single dose, and will be recommended to come to office in about 1 month to follow up. Also, we recommend her to the patient to inform her partner about the condition and direct him to the primary care physician for reevaluation and treatment. Also, we recommend referring back to the office or going to emergency department if symptoms still persist, or for a couple of days, or patient develops systemic infection response.